Hey, welcome back to Healthcare Consumerism Radio. This is Doug Field, the CEO of the Institute of Healthcare Consumerism, along with my co-host, Brent Macy. We're excited about this segment. We've got, one of the industry leaders, Rick Joyner, CEO of eflexgroup, joining us today. Good morning, Rick.
Hi, Doug. Thanks for inviting us on. I really appreciate it, the opportunity.
And David Shaw, are you on with us as well?
Yes, I am. Again, thank you for the opportunity to be able to speak at this point.
No, good to have you both on here. As I said at the intro, Rick is, one of the industry's leaders, and I think you're doing two things very, very interesting that actually shows where a free market is as far as helping address, concerns that brokers may have, how you help brokers become successful, and then turn to consumers and help consumers that may be caught, in some of the gaps with Obamacare to deal with some of the, financial implications of their care. And so, Rick and David, talk to us about both these initiatives. I'm very interested to learn more.
Well, we're a, consumer-driven TPA. We have the FSAs, the HSAs, the whole shot. And this will be almost my 30th year in this space. And our mission is to work with brokers and help their clients. In fact, we always have a tagline that we want to make our brokers look good. That's not the point of today, in the sense that we have several different aspects going on. Brokers are really looking to figure out, this whole private exchange area, how to do it. And from our vantage point, it's just a myth. The private exchange, because carriers don't want to, multiple carriers don't want to play in the same group, and it's actually not very efficient. However, what we've done for our brokers is we want to change the traditional role that a TPA has, and we want to be their partner. In other words, we want to partner to help them grow. So we've actually created a new entity called Fresco Benefits. And we all know what a fresco is. It's a type of painting, but the painting becomes integrated into the broker, in this case the broker, or the wall. And what we want to do is we're using benefit enrollment system through bswift, and we're bringing products to bear so that brokers can create their own private exchanges, in a sense, if you want to call it that, with their own health insurance products. So we're not trying to reinvent the wheel, but we are trying to bring them more increase in commissions and profits and things like that, and become a partner to help them grow. Because if they grow, we grow. But the interesting thing is that this way, they now have a partner that can offer, income and profit sustainability over the long haul.
So
that's our. Go ahead.
No, I'm sorry, Rick. I don't mean to step on your word. I apologize. So, have you created a co-branded exchange model for your brokers? Is that what you're doing?
Exactly. Okay. And bswift runs the Nevada exchange, now Connecticut. And what we can do is not, when they go out, like I said, when I open this, Doug, health insurance doesn't want to play. Multiple carriers don't want to play in the same group. So what we're doing is bringing a defined contribution approach, not the ones that you see out there where it's dump the group, but it's for the bigger brokers that want to use that to help their clients contain their costs. So they can use their health insurance. We have ancillary products that we can bring to the table for them that are privately branded. And you're exactly right. It's private branded for the brokers.
Now, Rick, there's a lot of brokerage agencies out there that have launched their own exchanges. So this exchange would be more for individual brokers, or just smaller general agencies?
All sizes, our research has shown us, and our experience in the industry has shown us, and that's why Dave Scholl's with me on here, because he merged his TPA practice with us, and he's leading Fresco Benefits. And what's happening is that the brokers are starting to find out that private exchanges don't work. They're being able to go out the way that they normally do with their health insurance quotes, but B-Swift with our thing can operate similar to an exchange in the sense that one carrier can be chosen with multiple options, high, low, and then the employer can use a defined contribution option and then bring in ancillary products too. So we are very excited to be able to bring this initiative, and we appreciate your forum to be able to. You're the first that we've announced this to.
That's great. Hey, David, congratulations, and
Thank you.
is this ready to go for this fall open enrollment period?
Yeah, we were ready to go with this for the fall open enrollment period.
Okay.
And, the whole purpose of what we're trying to structure here for our broker partners is giving them the ability to react very quickly and put an exchange or a marketplace arrangement in place to their client or clients and do it within a very short period of time. A lot of these, if you want to call them exchanges or marketplace arrangements, if you want to take a specific client in an employer group, these things traditionally can take 10 to 12 weeks to set up, and that's a real problem when we get to the open enrollment period in October.
Yep.
You've got to be able to react and put these things up within a period as short as a few days.
Yep.
So the only way that can be accomplished is actually to have an ancillary type exchange that has the life, short-term, long-term, dental, and vision, those products already baked into the platform, ready to roll, that you can just plug off the shelf, pull off the shelf, and plug them in, and plug in the group plan that the broker still plays their traditional role in, and be ready to roll.
David, was Fresco Benefits, did it kind of spawn out of the idea that brokers were really seeking this type of option to be able to take to their clients? Was that where the development came from?
Yeah, we're just reacting to market needs that are out there, and there's a big need to react and do this quickly.
Mm-hmm. I think as I look across the market space, Rick and David, the interesting dynamic is that the ancillary supplemental health benefits side of this industry is very, very excited about the exchange platforms and the opportunities that it brings to the market.
Yeah, that's very true. It's kind of interesting because there's a lot of different options that are out there right now for a broker to look at in regards to a private exchange that can deliver them individual coverages and voluntary benefits. And again, that's one of the reasons we're doing what we're doing now. These platforms out there right now are actually charging substantial subscription fees to the brokers just to have access to the product.
Yeah.
Mm-hmm. And then they turn around, and as you look at the commissions that are on the products, the bulk of the commissions are being retained by the enrollment platform or the call center that's handling it for the broker. Our whole concept is to re-engineer that whole process so that we can have more competitive products to be sold on a voluntary basis, as well as a larger percentage of the commission and more revenue driven to the broker, not to the entity that's delivering the product, and eliminate these fees that they're paying just to have access to it.
Yeah. Now, David or Rick, what is the education process with these brokers? I assume if there's a broker who wants to take this to their employer client, they're pretty well versed in the functionality of how an exchange is going to work. But is there an education communication struggle with some brokers out there in regards to the exchange product platform, and then also the next step? If I put my employer into this exchange, what is the communication education process for then the employer?
Well, we're going to have a structure of communication materials, and we're going to be setting up some webinars in the very near future for our broker partners in regards to actually helping them and enabling them to develop a true strategic plan so they know exactly how to do this and exactly how to roll that out. But that's going to be part of our platform that we're going to be delivering to the brokers. Mm-hmm.
Hey, David and Rick, tell our audience how they find out more information about Frisco Benefits.
Well, we're in the process currently of setting up the company, the communication. They essentially can reach Rick currently at our 800 number, It's 877-933-3539. Rick's extension is 125, and my extension is 332.
Great, Rick. I wanted to give you at least 3 or 4 minutes to talk on this segment about your foundation too. I think you're doing something very interesting there. Would you mind, spend a little bit of time introducing the foundation to our audience, please?
Mm-hmm. Thank you very much, Doug. I really appreciate that. Yeah, it's something that's a real passion of mine. Remages are the wings of birds, and what we want to do is we set up a foundation to lift people out of the fear of not having insurance and having out-of-pocket medical expenses, and then for the brokers to be able to cover them with insurance. Currently, brokers are viewed as, and this irritates me, they're viewed as sort of profit takers, kind of feeding off the system. And we know it's not true because we provide a very valuable service. Well, the thing is that brokers normally and typically, work their nonprofits locally, little leagues, things like that. But this is a way on a national basis that they can actually donate to Remages Foundation, recommend that somebody purchase insurance, and then they can funnel the premiums through Remages, thus getting a tax break and avoiding the whole concept of rebating and all that. The whole idea is to help people. We still are going to we're not going to help them more than 50% of their expenses. We also are recognizing the subsidies that some folks can get through ACA, but it's the people we really want to help are the working poor that are going to have the toughest time having to buy insurance and then let alone affording it, even with the ACA out. But what this will do is allow brokers to be able to go into their local community, show that they've actually helped the family. That publicity will hopefully a fire will start across this country with brokers doing this. And what will happen is that we'll be in the media as brokers showing exactly the role that we play very visibly with the lives that can be helped. The other area that we want to focus on, too, is the out-of-pocket medical costs that are so prevalent with all of this. And so that's what Remages is designed to do.
And you can find... Go ahead. And the goal, Rick, and again, I apologize. I can't see your eyes, so I step on your words. Apologies. The goal is to raise an additional $1.5 million. Is that correct?
Yeah, we're going to need that for some infrastructure stuff. We've got a retired CEO that came out of that runs nonprofits, and it's just fantastic. My son is doing that too. So it's a lot of it's voluntary. We're trying to raise $1.5 million right now. And we want to start helping folks at the turn of the year, and so yeah.
I'd like to know a lot more about this, Rick, and to educate our audience on this. And I think that from my desk to yours, I'm going to put the Institute's initiative behind helping you guys with what you're doing here.
Fantastic.
Oh, wow. Thanks a lot. That's just fantastic, Doug.
You're welcome. Hey, Rick and David both, we're about 30 seconds to go, so can one or both of you guys give us a clear takeaway that you want to leave our audience with?
Yeah, I think that, the brokers basically that are out there simply need to, look at what they're doing and evaluate their practice. And, ACA is all about change. And the brokers that are really adopting change and adopting technology to roll with this are going to see an extremely high amount of success and build their firms going forward. That would be the best takeaway I could get.
All right. That's great. David, Rick, thank you so much. You have a great weekend. And, Rick, let's you and I talk next week.
Yeah, that'd be great, Doug. And thanks so much again for this opportunity, and thank you so much for all you do.
All right. Appreciate it. To our audience, stay tuned for the next segment of Healthcare Consumerism Radio.